have teachers in Rice Lake, and they have a proposal that's, they're gonna go forward, but they have no choice, and it's different than what they have now.
Exactly, that's exactly where I'm going. So what they did is they are now going to have a health insurance policy that has a deductible on it. And it's, I think it's $1,200 deductible. Just by switching that, the city of Rice Lake is going to save $1.2 million just on their health insurance premiums. It's a huge amount of money, just by having a deductible. I'll give you an example of what I think is completely outlandish and crazy. I'm now a state employee, so anything that happened in collective bargaining, this affects me because that's my job. I'm a state employee also. And when I sat down and did my human resources and with my benefits package, I've been self-employed and owned my own businesses for 40 years, so I don't know anything about packages and benefits. I had to pay for them all myself. They sat down and talked to me an hour and a half to go through a packet that thick. And I was flabbergasted. I said, an hour and a half to give me an overview of my benefits? That's nuts. Well, it did take an hour and a half. And I was like, yeah, I don't need that. I don't want that. Why would you pay for that? You know, but it was all bargained. It was all collective bargaining. That's what the unions had collected. And being I'm not represented, but if the unions got it, then the non-represented employees get it too. And when they got to the health insurance, here's your health insurance policy. No deductible, no copay, no this, no that. You get this, you get that. Premiums were $1,949 a month. I said, excuse me, $1,949 a month you're going to pay for my health care? I said, I'm 58 years old. I haven't spent $1,950 in 58 years. I've been very fortunate. I've been very healthy. I've never been to the doctor twice for 58 years. I said, why would you pay $1,958 a month for my health care premiums? That's stupid. I have worked and I've saved and I've got assets because I've lived very frugally all my life. I says, I can afford to put $5,000, $10,000, $50,000 into my health care. So why don't you give me a health care policy that has a $5,000 deductible, $10,000 deductible, $50,000 deductible. You could save the premiums they're paying for me is like $24,000 a year. I says, if you give me a health care policy with a $10,000 deductible and your premiums could at least be half that or even less, a $50,000 deductible, I bet you the premiums wouldn't be $200 a month. I said, why don't you do that? Can't, because you have to give everybody the same thing. I said, that's insane. I don't even want you to pay $1,950 a month for me. I used to say it. I said, I wouldn't take that if somebody else paid for it. But guess what? Somebody else is paying for it. You're paying for it. That's stupid. And then they come to
how much is John Q. Public that works for Bubba's whatever, how much does he pay for health insurance if they're going to have people health insurance? It's the same thing.
When I was self-insured, self-employed, I paid 100% of it.
That's not what I'm asking. I'm asking how much was that? If you pay for all of it yourself, my point is, I don't think that.
I'll tell you exactly what I paid for.
Because through the government, we're paying more. Is that what you're saying?
No.
On the street?
Oh no. What I'm saying is the policy that they're providing for me is not fiscally responsible. Insurance is insurance. Insurance is for catastrophic events that you couldn't financially handle. And you spread that liability around about thousands of people. So if somebody has a catastrophic event, we all put a little money in and we take care of your house when it burns down.
Right.
Now, when I get the sniffles and I go to the doctor, is that a catastrophic event? No. But I have insurance for it. So I go to the doctor and what do? They charge me $200 because I have the sniffles. You pay for it. That $1,950 policy pays for me to go to the doctor with the sniffles. That's not a catastrophic event. So it's not so much that it's wrong that we have this health insurance, but it's fiscally irresponsible to have that. I don't carry liability insurance. I carry liability insurance on my car, but not comp and collision because it's stupid to have that. I drive used cars. I haven't had a new car since 1972. That was my choice. So I've saved enough money by not paying for collision and comp for 40 years. I can buy any car I want. But there's people out there that have full comp, full collision, full liability, health care insurance for the sniffles, and they go to their graves poor. They're insurance poor. That's fine. That's your choice. I don't want the state of Wisconsin paying $1,950 a month for my health care because I think it's stupid. I think it's fiscally irresponsible. It's not insurance. It's a payment plan. So I would like to have the option to save the state of Wisconsin $15,000, $20,000 a year on just mine. And there's, what, 300,000 state employees. Multiply that out and see how much money we could save. State Rice Lake School District saved $1.2 million by just changing their health insurance, because now they can. 3 months ago they couldn't.
Along the same lines, the school board said that they can keep all the teachers, no one's going to have a cut in pay, cut in salary for the year, and this other insurance come on, but the administrators are getting like 3% raise in the same budget fiscal year.
You know, I don't know that for a fact because I'm not involved in their direct negotiations, but I'd be awful surprised if they do, and if they do, they're wrong.
And I don't know if that's how I works for Rice Lake.
Yeah, I'd be awful. If they have the guts to do that, I give them credit for having a lot of guts. I don't think I'd do it.
I guess I don't.
If they do, they're wrong. We all have to tighten our belt. And if administration decides that they want to take a raise and that everybody else, pay more towards their co-pay, then that's wrong. You'd have to show me that. And I will ask Paul and find out. Because if they're going to take a pay raise, especially the ones that are at the higher end of the spectrum, that's not correct. And another thing that was a question on the radio the other day about raises, when you do it by percentage, raises should not be given by percentage, they should be given by dollar amount. And actually they're correct, because if you give a 3% pay raise to somebody that's making $200,000, they're making good money. You give a 3% raise to somebody that's making $30,000, it's nothing. So it should probably be done based on a dollar amount. And I understand it's a geometric progression. When you start giving percentage rate increases, at some point in time, the geometric progression goes along, and all of a sudden it just skyrockets. And that's what we're happening. We're at that point right now with our debt and stuff like that. It's just skyrocketing, and then it's out of control. But if there's anybody in administration that's taking a 3% pay increase, I've got more guts than I do. And I will look into it. Mark that down. Yes.
I appreciate the work that's been done with the budget reform bill. I think there's a lot more work to be done on looking at how we finance education. And I wondered if it wouldn't be possible at some time to delink state shared revenue and aids from property values. We've been killed, and in the past 2 years, particularly last year, I've written both Jock and Huber about the issue. I'm on a lake. When the Rice Lake School District increases its budget 13.1%, when Spooner School District, after a few short years, after passing a referendum for $34 million for a new school, of which $1.1 million went for operating costs, and then a few years later comes back with a $2.4 million referendum, there's got to be a limit of how far we can go. And I learned a lot from the budget reform bill, because what I learned is that I don't have anyone at the bargaining table for me.
That was part of the problem.
There's nothing there for me. I found from the comments by superintendents throughout the state that there was no distinction between the bargainer and the bargainee.
No, that is a problem.
And that was very, very upsetting to me.
There is now.
And I think that's the way to go. This is the first chance I've had to speak to you publicly, and I'd like to thank you for your work.
Thank you.
I was really upset when I wanted change, and I used the system in the ballot box to get change, and then it didn't take place because of the senators that walked out. And that was really the reason for the first Boston Tea Party. It was taxation without representation. And I lost my representation that I voted for. And I certainly hope that those conditions can change in the future. I think the emphasis has been too much on the negatives, on collective bargaining, and it should be in the process of what people did to us in Madison by not letting our vote be counted.
Yeah.
So thanks again for all you've done.
Thank you.